Data by the Rhode Island Department of Health shows hospitalizations continue to rise, putting more pressure on the state's hospital system.
And now with the new Omicron variant being detected in the U.S., what could this mean for emergency rooms already pushed to their limits? 12 News reporter Anita Buffoni brought the question to a top emergency room physician. She joins us now in studio with the details. Anita?
Well, Mike and Shannon, preliminary data suggests a COVID booster offers protection against the Omicron variant. That's a hopeful outlook as emergency doctors worry how this new variant will impact an already strained hospital system. If you are unvaccinated, you're 5 times more likely to be infected with COVID-19 than those who are vaccinated. That's according to the Rhode Island Department of Health. And with cases and hospitalizations on the rise, a top physician with Brown Emergency Medicine explains hospitals are stretched thin, partly due to unvaccinated people being admitted who are very sick.
Expect that you are going to have long waits in ERs, not because we aren't working hard, but just because there are so many patients who are sick across the state, and we don't have enough space or staff to take care of all of you.
Preliminary studies by Pfizer say a vaccine booster may offer protection against the new Omicron variant. Dr. Megan Ranney using this encouraging news as a reason to get the COVID-19 booster.
That booster, whether for Pfizer, Moderna, or Johnson & Johnson, makes a big difference in the face of these new variants.
Dr. Ranney stopped short of saying whether a mask mandate should be reinstated, but did say to take extra precautions, like wearing a mask in crowded settings. Now, the Department of Health just announced it is stopping operations at state-run vaccine clinics, moving to community-based sites. The Cranston Vaccine Clinic will close December 18th. I'm Anita Buffoni, 12 News.
An update now. There's some good and not so good news in today's COVID-19 report from the Department of Health. The number of people in the hospital is up again, now at 226. Though that's less than half the number of people hospitalized this time last year. Fortunately, the health department is reporting 0 deaths, and the transmission rate is down slightly, though it's still high. We're seeing long lines at some COVID-19 testing sites, too. Our Alexandra Leslie took this video this afternoon while at the McCoy testing site in Pawtucket. The health department says they're getting a lot of calls and emails right now from people looking for test results. As we reported last night, the state is still trying to catch up because of equipment issues in the labs. They're asking people to wait at least 48 to 72 hours after their test before calling or sending an email.
Meantime, Rhode Island has passed another vaccination milestone as it works to bring vaccination sites closer to home. The health department is reporting 75% of the state's population is now fully vaccinated, while nearly 85% have received at least one shot. Also today, the health department says they will be closing the remaining large vaccination sites. The Sockanosset Crossroad location will shut down on December 18th. And the vaccination site at the East Providence Senior Center on Taunton Avenue will give out its last shots on December 29th. The health department says they'll be running about 100 vaccination clinics over the next month at schools, churches, senior centers, and other community locations. They'll be listed on the state's vaccination website, and we have a link right now on our website, WPRI.com.
State health officials tell us that the Omicron variant has not yet been detected in Rhode Island, but still emergency physicians worry how it could impact an already strained hospital system if and when it comes here.
12 News reporter Anita Buffoni spoke to a top ER doctor about this. She continues our in-depth coverage tonight. Anita?
Well, Mike and Shannon, a COVID-19 booster shot could be your protection against the new Omicron variant. That's what preliminary studies found. And with ERs pushed to their limits, emergency doctors are urging you to get yours to avoid more strains on hospitals. One emergency room doctor explained unvaccinated Rhode Islanders who get COVID-19 are one of the reasons hospitals are filling up. The Department of Health says you're 5 times more likely to get the virus if you aren't vaccinated.
It is just exhausting to see this preventable disease back yet again.
Dr. Megan Ranney is a top emergency room physician. She's urging Rhode Islanders to only go to the ER for a true emergency.
Our hospitals are full, our nursing homes are full, our skilled nursing facilities are full.
A preliminary study by Pfizer found a booster may offer protection against the Omicron variant. Being fully vaccinated at worst, you're going to have mild symptoms, according to Ranney, in turn preventing hospitalizations. But scientists are still working to fully understand the new variant.
There's a long way between where we are today and final knowledge the science is accumulating and changing every day at this point.
Randy didn't go as far as saying a mask mandate should be reinstated, but did encourage Rhode Islanders to take precautions, like wearing a mask to help prevent the spread of the virus, especially with the holidays approaching.
And we may be hearing a lot about the new Omicron variant, but Dr. Randy said the highly contagious Delta variant is still very much here, once again reiterating the vaccine is your best defense from getting sick. I'm Anita Buffoni, 12 News.